Hello, everyone. Welcome to another review class for our lab students. Auricular medicine, number 19. And today we shall focus on anti-helix points, both Western and Eastern approaches. Okay, so here we have the anatomy of the anti-helix. Okay. And you can see that we have the superior. Other books would call it the posterior crus, or the posterior root of the antihelix. And then we have the inferior, or the anterior. And this one is, other books would say this is the posterior, okay? Or the lower part of the antihelix. So let's start with the first one. As you can see, we have emphasized the cerebellum, okay? So again, to refresh your memory, this is the antihelix, okay? So we'll start from the lowermost part of the antihelix. We have cerebellum. So the location of the, I think you're already familiar with the cerebellum, diba? Okay. The location is on the tail of the inferior antihelix, yung buntot, no? Now, this is quite important because there are many people suffering from tremors, hand tremors, no? When they have wind, okay? So this is more direct way of dealing with it. For those who have spasm and who cannot coordinate their movements, and those with cortical movements, and it is also good for vertigo, as well as depression. So depression, as we remember, if you remember, can be characterized by a lot of phlegm, no? So the cerebellum. Next, we have the cervical spine, okay? So from the cerebellum, we go to the cervical spine, okay? The first part of the spine, of the spinal cord. So where is this located? This is located on the concha side, okay, of the lower antihelix tail, and it is directly above the cerebellum, okay? So if this is the cervical spine, then this is the cerebellum. Okay, so the cervical spine, for those with stiffness, no, neck stiffness or neck spasm, pain, torticollis, and it is also good for headaches, especially when you do not have a good posture while doing your computer, while you're in front of the computer. Okay, so we have the cerebellum, which is good for tremors and depression. Then we have the cervical spine. So let's study this together. Cervical spine is good for neck stiffness or neck pain, and then also for headache, okay? Torticollis. Okay, the third is the heart, okay? Can anybody comment? Diba in Chinese, ear acupuncture, the heart is located here. And if you also try to recall the bakshu point of the heart, diba nandito sa bladder? What's the bakshu of the heart, anyone? Ma'am Trix?
There 13 Doc.
Hindi yata. Hindi.
20?
Hindi, isa pa. Bladder 20 is spleen. Uy, kayo nakakahiya. Naka-record to. Bladder 15.
ESP.
Bladder 15. Okay, you know what I do here? Okay, diba? This is the, okay. You have to have a landmark. Okay? I would this is the 10 and ito dito is 30. Okay? Yan. So, what do you call this? The cruise of the helix, yeah, or the root of the helix. So you extend that towards here, that would be your bladder 10. Now, bladder 10, ito, and this one is here. Dito naman, this is our basis. This is gallbladder 30. Sorry, bladder 30. So between 10 and 30 would be 20. And this is not 20 yet. So yun, try ninyo. I've also done this on some patients, those with palpitations. So mayroon talaga siyang ano, okay? So bladder, kasi usually when you have palpitations, it's ano, especially pag chronic, diba? So we would use the bladder 15, which is the back shoe of the heart here. Remember? Okay. So again, this is the heart point. And I would usually combine it with the heart point here, no? Yan. Okay, the location is the central side of the antihelix, the center. Okay, so if this is the entire antihelix, the bladder 15 or the heart point is located in the center. Okay, indications, of course, it's for heart dysfunction, hypertension, palpitations, irregular heartbeat, especially if you notice when doing the pulse, um, the the rhythm would become irregular, no? And those with poor blood circulation. Um, have you tried looking at your feet? Especially when you're above 40, I've noticed. I'm also guilty to that because I think something happened a few years, several years ago. Yung umiitim yung paa. Any comment? So that's a sign of peripheral insufficiency.
What do you mean, like, paano, as in, like, darken?
You would really see some congestion, parang may kulay, no? So you try observing the
Sa buong foot,
yeah. Some would only
which
have it
part?
on one foot, others would have both feet. Okay, so that means the circulation there is so poor. There is venous insufficiency. So ibig sabihin, the blood there doesn't circulate at all, and you have to be very careful with the heart. Okay, so yeah. Any questions? Excited?
I'm
So
checking. Checking mine.
yeah. Next, after the heart would be the thorax, the thoracic spine. So the thoracic spine is 0. Okay. Um, how many? Let's ask Sir Mark. How many thoracic vertebrae are there?
Pag thoracic lang po hanggang 12 lang po, Doc.
Oh, wow, galing naman. Talagang ano siya ha, bone setter na bone setter. Okay. Yun. So this is the thoracic spine. Located on the concha side. Concha side, malapit sa concha, no? So this is the Simba concha, diba? This is the superior concha, and this one is the cavum concha or the inferior, diba? Okay, so this is the thoracic spine, and it is very good, of course, no, diba? Upper back pain. Upper back yan. Basta the neck area, that's cervical spine. So if the patient complains of upper back pain, which also includes the shoulder pain, as well as the lower back pain, diba? Upper and lower back, and also when you have osteoarthritis of the spine.
Mga posture po ayos.
Ano po?
Yung pag tinusukan po yung ano niyan, yung thoracic, Doc, meron kasi pasyente ako na kyphosis, naayos po yung shape ng ano ng katawan pag tinusukan po.
This area, this point? Wow.
Yes.
Oh, nice.
That's amazing.
Subukan ko na po yung uba. Naayos po siya. Para siyang nagtusok tayo sa katawan, ganun ang effect niya.
Oh.
Okay, amazing.
How many sessions, Sir Mark?
Ano po?
How many sessions? Ilang sessions?
Per
Bago
session lang po. Nakikita ko ng improvement mga pasyente ko na
parang
mayroon.
na nag-align na siya.
Oo, di na ako nahirap na minamas lang.
Yung
Oh, nice.
ano, kyphosis?
Mga kyphosis, lordosis, yung mga kumukuba po yung spine, naaayos po siya pag tinusukan po siya. Parang back siya po sa likod, ginagawa po sa tenga.
Amazing.
Oh.
Galing. Baka iba na yung powers ginagawa.
yes.
May bisin ibang modality. Try ko kaya yan. Excited na tuloy ako. Uy, we have no webinars next week, ha?
Okay.
Sige, rest muna tayo and study. Para, di ba, all work, no play will make you dull. We will resume on 16. Yeah. Time runs so fast. Grabe. No? Yeah.
Yes.
Okay. Okay, next naman, we have the buttocks. Thank you, Sir Marka, for sharing. So I think
Yes, thank you,
Sir
Sir
Mark
Mark.
was to correct the deformity, no? Siguro gumamit siya ng gold needle, gold ear seeds. Yeah. Or gold needle.
Gold needle.
Yeah. Next, we have the buttocks point. Now, this is also very important, I think, and it is located on the peripheral side of the inferior antihelix screws. Indications, of course, low back pain, pain in the buttock muscles, hip pain, and sciatica. Okay, I would like to share with you this one. This is so important. When you have hip pain, diba, gallbladder 30 is here. Ay nako, and then gallbladder 29. Diba the most important point for hip pain is gallbladder 30, no? You can also use 41, 42, but dito banda yun eh. You try it. It's so amazing. And you don't even have to use a very long needle. Kasi dito lang. And you'll be amazed. This is GB30. This is gallbladder 29. As you can see, it's very near the buttocks. Make sense? Diba?
Yes.
Yeah, and this point is good for hip pain. So might as well.
But Doc, should you needle or ear seeds lang?
I needle
Or
first to justify the cost. And then I would end with I would ask the patient to I would replace it with ear seed later. And I'm thinking of doing a nice looking ear seed. No, sige, watch out for it. Kaya lang baka dumating, I'm not okay, anyway. I'm sure you're all excited. Okay, so that's it. Hip pain, sciatica. Just sharing, no? Dito, GB3029, or iganon mo na. You might want to put all the ear seeds dito lang. Diba? Yeah. But so far, I had 2 patients. I've tried it using the ear lang, nobody. Next, we go to the lumbar spine. Okay, this is the lumbar spine. So lumbar, buttocks, thoracic. This is the heart. Okay. So this is the one for the medial, no? Malapit sa sa mukha. Okay? So this is located on the inferior antihelix screws, peripheral side of the screws. Peripheral. So of course it's good for low back pain and leg pain. You can also use this for sciatica, back strain, and disc degeneration. Okay? So if you have patients like this, kasi most likely meron din yan silang hip pain, diba? If you know sciatica. So here, there. Okay? Or you try to observe first without putting any alcohol, without cleaning the area, try to look for some redness there or some capillary congestion, no? To really confirm. So I guess if you're so into the proper needling needles to use, you might want to use the sedating needles, the silver, no? So now I'm experimenting on silver ear pellets. Next, we go to sciatica, sciatic nerve, no? So it's located on the midpoint. So this is the inferior antihelix screws. So it's located in the midpoint, no? Dito po, of the inferior antihelix screw. So this is good for sciatic neuralgia, lower limb paralysis, post-polio syndrome. I think you've seen a patient who had post-polio, okay? I know if that patient will go to Sir Mark, makakalakad bigla na mabilis.
Yes, Doc, nasubukan ko na po yan, Doc, na ano po. May pasyente ko po naka-wheelchair. Takot naman po ako magtusok sa katawan. Nagtenga po ako, Doc.
Wow,
Wala pang 30 minutes po nawala yung pain, tsaka nakatayo bigla yung pasyente. Sciatica, tsaka merong yung disc niya parang umusad.
oo, nag-herniate. That we call that herniated
Hernia.
disc, yeah.
Opo.
Herniated lumbar. Ang galing! Alam mo, inassume ko lang. I thought, yung pala totoo. Grabe, amazing.
Ano lang ako dyan, Doc, ano po, sinubukan ko lang po siya na
Oh,
yung mga parts na body part, may hernia siya, plus yung sa kabila po, yung internal na imbalance niya po.
okay.
Tapos sa kabila po ng po, spinal po. Ang ganda po ng effect niya, Doc. Sobrang ganda.
Kasi alam
Para
mo,
ka nagtusok sa katawan.
why it works, no? Because yung intent mo, no, to heal the patient. And I think that's one skill that you have. No? Di ba parang you really want the patient to get healed. No? Yun. Congrats,
Yes.
Sir Mark. I'm amazed. I'm amazed or naiinggit. So let's do this. Ang galing. Ang galing. You know what? If we do this a community, we can help more and more people. No? What do you think, Mom Tricks?
Yes.
True.
Yes. Kaya don't be like time will come. This is going to be the trend. Why would you ask the
Yes.
patient to pa, diba? So yun. I have a feeling na Kaya Sir Mark, you should teach na if you really want to help the people, no? Before it
Opo,
becomes
Doc.
so popular. Share your blessings. Okay, sacral spine. Alam naman natin, this is a fusion of 5 bones. So you have 4 sacral foramina, di ba? So this is located on the inferior antihelix screws at the central side of the screws. Central. This one. Central. Nasa gitna.
Hello po ako, Doc. Good afternoon.
Good afternoon, Doc She. Yes.
Kasi, hi, good afternoon, Miss Trix. Doc, kasi dati, parang nasanay ako na pag nag-assessment, yung dito sa may posterior peripheral, ano may tawag dito? Dito sa may antihelix part. Parang dyan ako kasi doon ako nasanay, Doc, from Albert. Yung dito sa may neck, dito sa may pinaka-tail. Tapos yung
Dito.
sumunod is yung sumunod is yung cervical, tapos yung sa mid part is thoracic. Tapos yung lumbar, dito na may banda sa may papunta na dito sa may triangular fossa na banda. Tapos hips na siya. So, anong susundin natin dyan, Doc, for assessment? Ito na siya or ano kaya?
No, ganito, Doc She. I will be presenting both sides, no?
Okay.
Right after this, you will see the Chinese, the original one. So this is the
Okay, Doc.
European. Sige, let's discuss that later. Thank you for your thoughts. And I know, you know what? If you really, really want to help the community, let's do this. I cannot do this alone. And in fact, if you've noticed, padalang yung ating webinar. Hindi naman kayo nakikinig lahat, no? Because I'm so excited and kailangan ko ring i-share ito sa mga ano. And I know this can, this can result to something positive. Okay? Just don't forget to give the diagnosis, especially when you have hip pain, no? Hip pain kasi is the most common pattern there would be dampness and cold. So you need to really, really find out ano ba yung cause. So we just don't needle the pain area or the area that is involved, but you have to needle what is causing the pain. So yan yung tinatawag nating treatment of the root. No? What we're actually looking at right now is the branch. But again, you need to really prioritize. And what is important for this patient? Is it the pain or the... So unahin mo yung pain. Na ba? Yan. Okay, I'm excited talaga and thank you so much. I think it's better if we do this like not every week kasi parang I've noticed people get, parang nabobore. And it's good to know that you are really so excited about this. And I hope you can make this very popular. So let's go. Sympathetic. This is so, we have 3 points there, diba? So I didn't find it here, pero you would know where it is, no? Sa inferior antihelix screws. Diba sa loob nito, no? Okay. There are 3. Okay, so indications, imbalance of the sympathetic and parasympathetic nervous systems. So if you're the kind of person who works 24 hours a day, so obviously naka-sympathetic mode ka. BP goes up, you can hardly sleep and all. But so if you have that kind of patient, we should be able to bring the patient to parasympathetic mode. And if you needle this point, it just does that, no? Amazing talaga. So it's good for pain, poor blood circulation. You see even irregular rapid heartbeat, chest pain, muscle spasm, kidney stones, gallstones, digestive problems, dysfunction of the autonomics. Okay? Okay, so now let's go to the next one. Earlier, we covered the points on the more on the medial side, no? Ito yung malapit sa muka, diba? Well, let's now tackle the points on the lateral side, dito sa banda sa may ulo na, okay? So, we have the neck part. I think this is your favorite point, and I'm sure Sir Albert has really mastered this. As you can see, naka-align lang siya with the cerebellum. Make sense? So if the cerebellum is towards the medial, ito namang neck would be towards the lateral. Okay? Usually, I would try to also press this area. No? Yan. But you have to look for the most painful, most tender point. Okay, so location, peripheral of the lower part of the antihelix tail. So this is good for tension and soreness of the neck. It's also good for sore throat, torticollis, and hyperthyroidism. Then we go to the clavicle, the collarbone, right? Dito palang collarbone. So the clavicle is located here. So my landmark here would be this one, diba? Crus of the helix. Sa taas ng konti. Okay, clavicle. Peripheral side, middle part of the antihelix body. So it's good for clavicular fracture, shoulder pain, arthritis of the shoulder, upper back pain. Next, we move to the breast. Now, for women, this is very, very relevant. If it is a little bit discolored, you should already start asking questions like, do you have, issues with your breast? no? So peripheral side siya of the middle part of the antihelix body, just below the chest point, no? So we're going up na. Clavicle, going down na pala, sorry, going down. Indications, breast cancer and premenstrual breast tenderness. So if you notice something unusual here, and it's going to be very tender, and then you also notice that the tongue is so purple, no? And then sa tongue area, you will also need notice some anomalies, abnormalities in the breasts, the side, no? You will have to refer this patient to an oncologist. Next, we go to the chest point. So clavicle, breast, and chest. The chest is the peripheral side of the middle part of the antihelix body. And it's good for heaviness, no? Yung parang nabibigatan, fullness, pain in the chest, intercostal pain. Remember, intercostal, yung between the ribs, no? Cough, asthma, hiccups. Just for symptomatic relief. Then we have the abdomen. Sumakit yung tiyan. Somewhere here. Okay. So nasa thorax. Oh, okay. So if this is the likod, this is the front. You noticed? So when it comes to the neck, you have to determine sa likod ba or dito. Okay. Make sense? Okay. Abdomen, peripheral side of the upper part of the antihelix body. Of course, it's good for abdominal pain and low back pain as well, and hernias. No? You know, hernia. How do you call that in Tagalog, Sir Mark? Hernia.
Los, Doc.
Yes, ang galing naman. Alam nyo, kulang na lang sa inyo tataka ng MD. Ang dami talaga matutulungan. Next, we go to the thumb. This is the thumb. Just imagine the kamay there. This is the thumb. Superior antihelix crus, which is very close to the scaphoid fossa. Okay, so yung na-sprain yung thumb. Okay. Okay, let's now go to the Chinese version. Remember the red book? I love the author so much because she said, just have to remember the 100 points. Okay, let's try to integrate na. Tingnan natin if nagkakatugma sila. So here you could see, so this is still the antihelix, diba? Ito naman another view naman to. Okay. So we have here the letter L. Tingnan mo yung L niya. Ang 76 is the toe. 77 is the heel. And then 78 is the ankle. Ankle, heel, toe. Ankle, heel, toe. Can you imagine yung paanan dyan nakatapak? No? Ankle, the heel. Sorry. Nabaligtad pala, no? Ankle, toe. Hindi pala. Doesn't make sense. Ankle, heel, toe. So most easily located in relation to each other. No? So this is the left ear of the person. They form an inverted L. So 77 is heel, 76 is toe, 78 is ankle. Ay nako. Lalo na yung mga natapilok. You can, at saka you have to deal with pag natapilok yan, kung super tagal na yung pain, that's definitely blood stagnation. So you need to open the gates, no? Next we have, okay, let's be more specific. The toe is the most lateral point, and this is it is found where the inverted L begins. The heel, number 77, is the junction of the two strokes that form the L. Di ba yung mga ang tataas ng mga heels, no? You'll find this very effective. Ankle, yung mga naglalaro, no? Or yung mga natapilok, inferior to heel point where inverted L begins. Now, another very, very common point, you should all memorize this, is the knee. You know why? If you have a kidney issue, mayroon kang knee pain and low back pain. Okay? So, I would like to call this GB30. Ay nako, Doc, no? You try this for hip pain. You will never forget me. 3029, GB30, GB29. So if this is for the hip, so this is the knee. Okay? Then we have lumbago. Okay? Here. So knee, lumbago. So when you have a kidney issue, both the knee and the lumbago would be tender. Okay? Now let's go to the points of the lower limb. Dito sila nagkaka 81 is the sciatic nerve. And I'm sure you've seen a lot of patients with sciatica, no? And then we have the ischium. I hope you remember the ischium. Okay. And then we have the buttocks. Pareho, di ba? Pareho siya. No? Sciatic and this one. More or less pareho. Now let's go to the abdomen. Oh. You remember where the abdomen was located kanina? Yeah. Pero para siyang ano ha? Okay. Low back pain din. Parang lumbago din, no? Then we have the chest, yes. Pareho, di ba? And then the mammary. Dito sila, I think the breast, dito pa yung breast area kanina. Oo. Yan.
Clavicle, Doc. Clavicle.
Ayan, clavicle to dito. The mammary was, yeah. May konting discrepancy lang. May konting discrepancy lang. And then of course, the neck, dito sila magkaano, no? So, ang hindi lang minention is the cerebellum. And I think number 89 would be the throat and the teeth. Okay? So, it's up to you. Okay, we'll now go to the spinal points. Wow, this is so important, no? So, the sacral vertebrae would be number 90. Pareho sila dito. And then lumbar. So, I would usually consider this as a group, lumbosacral. Dito yan. So pag the patient comes to you with kidney issue, kidney deficiency, sumasakit ang likod, sumasakit yung tuhod, dito ka na mag-concentrate. Okay? Then we have the thoracic. Yeah, I think pareho. Andyan yung expert natin, si Sir Mark, who will make a lot of people really come to him. Imagine tenga lang, no, nawala, na-correct yung pagkakuba. And then we have the cervical. Okay? Thank you for your attention.